Okay, let's talk about gowning, log roll, immobilization, and restraints. Now, when it comes to gowning, gowning occurs for those patients, those inpatients, I should say, who typically have an upper limb injury, or perhaps an IV, or may even have some paralysis or limited mobility in their arm for whatever reason. All right. When we are looking at assisting with gowning for when it comes to patients, the best practice is to have actually two technologists present at the time that the gown is put on or removed for whatever reason. Okay. When we are thinking of sort of an example of a upper limb injury, for instance, it could be a fractured humerus or it could be a dislocated shoulder. These would be patients who have come in through Emerge, but inpatients are not, or Emerge patients are not the only ones where you may have to assist with gowning. You may have to assist with the elderly population, for instance, if they've come in for as an outpatient for a chest X-ray, and they just have a few more sort of requirements when it comes to preparing for the exam itself. So there is a variety of patients that you may require to assist with gowning, but try to if possible keep two people there. Okay, now when it comes to placing the gown on or putting the gown on, it's really important that we protect or that we are mindful of the injured side of the arm. Okay, so we want to put the gown on so that the armhole of the gown goes on the injured or the affected side first. Then we proceed to the put on the arm for the unaffected or the uninjured side after that. Okay, that sequence is really important. We're trying to limit the amount of movement that occurs in the arm, and we have to think that the patients are going to be probably in somewhat discomfort. Okay, we don't want to have anybody feel resistant or uncomfortable. And again, when we are performing either the gowning to put the gown on or off, we have to also think of the patient's modesty and privacy. Okay, when it comes to removing a gown, we want to remove the uninjured side first. Okay, so again, if we sort of think this through, we can say, well, why would that be? Well, we're focusing on trying to make sure that that injured or that affected side is limited in its amount of movement or motion. Okay, when it comes to an IV, it's all because of the equipment perspective, but it's more along the lines of making sure that the patient is minimized when it comes to discomfort. All right, so when it comes to putting the gown on, think first arm is going to be the affected side or the injured side. When it comes to taking the gown off, think first arm is going to be the unaffected or the affected side. Okay, when it comes to log rolling, or what we would consider in the log roll technique, when it comes to using a slider board, the Alberta Health Services has a spinal motion restriction management and DI policy. All right, now this policy we're going to get into extensive detail about. In fact, you're going to even have you're going to have a lot of questions on this, and I even know that if I'm not mistaken, it's going to be an assessment. So just something to keep in mind. We're going to use this Alberta Health Services spinal motion restriction management and DI manual in our practice, okay, when it comes to actually a log roll technique using a slider board. As far as bolsters go, what we want to keep in mind is that bolsters are very good at providing the patient with comfort. This is important because when patients are comfortable, then they're much more cooperative, they're much more receptive, and just the whole success of the exam can be increased by just having that patient comfortable. Okay, and we also the success of the exam being that the radiologists have an opportunity to really have the best or the most optimal images taken for them to do their interpretation. Okay, so keep in mind bolsters or even sponges are really helpful from a radiologist perspective so that optimum images are taken. Now, there are occasions where patients, for whatever reason, are not able to necessarily hold or put their body part in that position, so we have to immobilize them or restrain them. Okay, we're going to talk about and compare the differences between immobilizing and restraining, but one of the best practices to use when it comes to trying to successfully obtain that image is through the use of therapeutic communication. We are going to go into more detail about therapeutic communication, but this is just an introduction that we do use the method of therapeutic communication, and you'll see and we'll get a lot more knowledge in regards to what that entails soon enough. Okay, immobilization. Well, the purpose of immobilization is to limit the movement during an exam. Less patient movement equals a reduction in the repeats, which equals a reduction in the radiation or exposure that patient is going to be delivered. All right. When it comes to immobilizing the patient, you do not need a doctor's orders, and that's the key, one of the key elements there. Okay, it is within your scope of practice to use different types of, I guess you could say, tools, such as sponges, tapes, straps, etc., like that. Now, certain types of straps, okay, not restraints, but certain types of straps to immobilize these patients if need be, or place them in that position. If you sort of reflect yourself if you've been injured, sometimes you shake or tremble uncontrollably. Well, that motion, it's not that you're trying to be difficult, but that motion, and unfortunately due to the injury, could possibly cause movement or blurriness on the images. Okay. Now, when it comes to nurses and doctors and guardians in assisting when it comes to immobilization, so particularly with the younger population, okay, we prefer to have other healthcare professionals, such as the nurses or the doctors, assist in the immobilization. Okay, we typically have a higher likelihood of receiving an exposure, whereas if a nurse or perhaps another healthcare provider assists in the mobilization, their likelihood of receiving exposure from performing these various exams is very seldom, if not almost nil. All right. Now, immobilization, when it's done, it is done at what we call the strongest points. So when it comes to immobilizing, we're thinking of the shoulders, we're thinking of the elbows, and we're thinking of the knees. So just visualize, say, an 8-month-old or even an 18-month-old, and you're trying to prevent them from moving, so you can get a picture of, say, their abdomen. Let's say they have a tummy ache and we want to have a look at their abdomen. What we want to do is we want to try to use the shoulders, the elbows, and the knees to keep that child still. Okay, all right. There is a technique that is used when it comes to immobilizing children, particularly at those locations, which you'll have plenty of opportunity to get your hands on when the time comes, but just be familiar. Those are the areas that would be immobilized. Items used for immobilization do include sponges, tapes, sandbags, lead strips or sheets, and other specialty devices such as circumcision boards, pigostats, and octostops. So keep in mind, there's many things that determine what kind of immobilization equipment will be used, and what the situation is, etc., like that. Okay, and then that's all going to be something that we're going to explore in much more detail as the time goes on. When it comes to restraints, okay, why do we restrain somebody? Keep in mind, we do not restrain somebody unless absolutely necessary. Okay, the doctor or the physician must have an order for restraints to occur. We restrain a patient so that it's to ensure that they don't hurt themselves or others. Okay, some individuals, for whatever reason, they'll be somewhat combative, aggressive, and that sort of thing, or perhaps they are harmful to themselves, so that would be one of the reasons we would restrain a patient. Another reason is we do not want the patients to dislodge any of the what we call therapeutic equipment. So for instance, if a patient has oxygen and they are continuously removing that oxygen mask or nasal cannula or whatever off, well, then that can harm the patient. And so, or we don't want them pulling on tugging on a urinary catheter. So there are different types of therapeutic devices that need to be kept intact, or in the integrity of them, so that would be a reason why we would potentially restrain a patient. We also too need to ensure that some patients who, for various reasons, perhaps you have someone who has dementia or Alzheimer's and they are unable or just not capable of cooperating. Okay, so they can't follow instructions, they aren't able to hold still. Again, too, that would be one of the reasons that restraints would be used. Okay, so most importantly, restraints, you need a physician's orders. Immobilizing, you do not. Okay, when it comes to restraints, there are a list of guidelines that must be followed. We're going to talk about those 7 points of when to use restraints and what that particularly means, which is why we just initially spoke about therapeutic communication, because really restraints are only used as the last effort in order to obtain the x-ray. Okay, when restraints are attached, they're attached to an immovable part such as the frame on the stretcher. They are not attached to the side rails, because what happens is that if you tie the restraints themselves to the side rail and then you lower the side rail, then we have a real problem here. Okay, so it has to be attached, restraints must be attached to something that does not move. We also want to be able to, when it comes to restraints, to have a quick release. So there's no knots. Okay, there's a certain method and technique that is used when you are tying restraints, but there are no knots. The other thing to keep in mind is that there is padding on these restraints, and that these restraints, when they're applied correctly, should not be tightened when the patient is moving around, because that can cause additional injury and restrictions in the respiratory system, or potentially even in their circulatory system. So those are some of the things we want to be mindful of when restraints are being used. Okay. The other thing to just keep in mind is some of the restraints are considered 2-point versus a 4-point. A 2-point restraint would be where the arms at the wrist area would be the only location where the restraints are used. A 4-point restraint, however, would be where the restraints are being used at the wrists and at the ankles. Okay? That's a 4-point restraint, wrists and ankles, versus a 2-point restraint. And again, too, we're going to talk in more detail about what that criteria is for when restraints are used, and those are points that are going to become very clear as to why they are used or whatnot. So that, in summary, is our little kind of brief overview of restraints versus immobilization, and that therapeutic communication. So the methods of therapeutic communication will be everything from summative to listening to, we're going to go through all of those different types of therapeutic communication further. We know that comfort equals cooperation, and that Alberta Health Services has a spinal motion restriction management policy and procedure. And when it comes to gowning, preferably, if possible, there should be 2 people, okay, present. And that is just something that is it's just the way it is, and so plan accordingly. If someone needs to get undressed, please allow them the time and the respect in order to do that, so that there's no rush, and that this exam, again, too, can start off on the right foot. Okay, that's it.